The trauma patient assessment station. All your stations, when you enter into the station, your examiner is going to greet you. They're going to take down your social security number. They're going to read the directions to you, and then if there is, they'll give you time to check out your equipment. And if there is a scenario with the station, they'll read the scenario, and then they'll tell you your time is going to start when you approach your patient. Your BSI can be considered as long as you say that you're considering it. And remember, guys, always say what you're doing and do what you're saying. Right? So, somebody read my instructions. Read it loud.
This station is designed to test your ability to perform a patient assessment of a victim of a multi-systems trauma and voice treat all conditions and injuries discovered. You must conduct your assessment as you would in the field, including communicating with your patient. You may remove the patient's clothing down to shorts or swimsuit if you feel it is necessary. As you conduct your assessment, you should state everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how you would normally gain that information. You may assume that you have 2 EMTs working with you and that they are correctly carrying out the verbal treatments you indicate. You have 10 minutes to complete this skill station. Do you have any questions?
No. All my partners are make-believe?
Yes.
Okay. All right. Okay. All right. BSI is my scene safe?
Yes.
All right. I have one patient who's a victim of being ejected from a motor vehicle, and I'm going to go ahead and put ALS on standby, and I only have one patient. So I'm going to take C-spine. Ma'am, can you hear me? And I'm going to pinch pinch the ear to see if I get a painful response. Right? She's moaning to the painful stimuli. My general impression of this patient is poor. She has an altered level of consciousness. Chief complaint is that she's been ejected from a motor vehicle. At this time, I'm going to go ahead and open my airway with a jaw thrust and look, listen, and feel. What are my respirations?
Wait.
All right, I'm going to go ahead and have my partner insert an OPA and put my patient on a non-rebreather at 15 liters per minute.
Consider it done.
All right, and then I'd like for my partner to take over the airway and the C-spine.
Consider it done.
All right, I'm going to move alongside the patient. I'm going to open up the shirt, exposing the chest and looking for my injuries. What kind of injuries do I see?
You see a small red injury.
On the left or right?
The right.
Okay. Then I wanted to ask, do I have any bleeding, sucking sounds, or frothy blood with it?
You hear sucking sounds, you see frothy blood.
Then I'm going to apply an occlusive dressing and tape it down on 3 sides, leaving one side as a vent.
Consider it done.
Do I see any other injuries on the chest?
Yes, you have a bright red injury, big.
Okay, over on the right or left?
The left.
All right. Then do I see paradoxical motion?
Yes.
Then I'm going to take a bulky dressing and tape it down on all 4 sides.
Consider it done.
Okay. So how are my respirations now?
22.
All right. This point I want to start doing a gross body sweep. I want to look for any major bleeds with my gloved hand, starting with the head. I'm going to expose the arms, open up the shirt sleeves, and check both arms.
You see blood.
Okay, is it bright red and spurting or dark and oozing?
Dark and oozing.
All right, I'll consider that a secondary wound. I'll take care of that later on. I'm going to finish my sweep, going up under the chest. Open up the legs. Do I see any bleeding on these?
Yes.
Here?
Yes.
All right, do I have bright red and spurting or dark and oozing?
Bright red and spurting.
I'm going to apply direct pressure with 4x4s. Is the bleeding controlled?
Bleeding is controlled.
I'm going to have my partner bandage that in place, and I'll continue checking for any other injuries. Then I'm going to come back and I'm going to check for my distal and my carotid pulse.
No distal pulse is present, and your carotid is 140.
All right. And what's my skin color and condition like?
Pale, cool, and clam.
All right. At this point, I consider my patient a high priority. She is showing some signs of shock. I'm going to send my partner to get a long spine board. And while they're gone, I'm going to continue with my rapid assessment, head to toe, looking for any other life-threatening injuries. And get a set of vital signs on my patient. I'm going to first check the arm, make sure we don't have any fractures.
No fractures, no.
I'm going to apply the blood pressure cuff. What's my blood pressure?
86/74.
And my pulse?
120.
And my respirations?
21.
All right. My, is there anybody here to give us a sample history?
No.
All right, my partners are back with the board. We're going to get ready to package the patient and get en route. We're going to position the board, and on the headman's count of 3, we're going to do a 3-man log roll. 1, 2, 3. I'm going to get her rolled. I'm going to raise up the back, look for any life threats back here. Do I see anything?
Nothing.
Then I'm going to go ahead and check my cervical and my thoracic for any injuries and look down the back for any other injuries.
No injuries.
All right, we're going to roll her back onto the board. 1, 2, 3. We're going to secure her to the board, and we're going to make sure we get a collar in place, move her to the back of the truck, and we're going to get en route. Once we're en route, I'm going to start my detailed assessment with the head. Here I would be looking for any deformities or contusions, abrasions, punctures.
None noted.
Okay, I would check the facial area for any bruising or swelling. I'm going to check the eyes for pearl.
Pupils are unequal.
All right, I'm going to check the ears for any CSF fluid or the nose. I'm going to look in the mouth to make sure we don't have any obstructions. We still have our OP and oxygen going. Check the neck vein for any jugular vein distensions or tracheal deviation.
Veins are flat.
I'm going to check the clavicles and palpate the chest for any crepitus.
None noted.
All right, and I want to auscultate the chest, listening for unequal breath sounds.
Sounds are equal by that.
All right. Then I'm going to palpate all 4 quadrants of the abdomen.
You have a distended abdomen.
All right, I'm going to make note of that. I'm going to check the pelvis by gently pushing in and down.
Pelvis is stable.
All right. If it was a male, I would check for any priapism. I'm going to palpate all the extremities, looking for any, or listening for feeling any for any crepitus. I'm going to check my pulses.
No distal pulses.
Can you feel this, ma'am? Can you wiggle your fingers?
Patient is unresponsive.
All right, I'm going to come down here, and I'm checking the legs for any movement or any crepitus in the bones.
None noted.
Okay, and look for any other injuries. Check my distal pulses here.
Distal pulse is present.
All right, can you feel this? Can you wiggle your feet?
Patient is unresponsive.
All right. At this point, I've completed my detail. I want to take care of any secondary injuries. I had a venous bleed on that arm.
Yes.
Okay, so here's my wounds here. I want to go ahead and get a 4x4 and have a partner bandage that in place.
Consider it done.
I want to check my bandage, make sure it's still holding down here. At this point, we got her secured to the board. We got her blocked in. We're heading to the hospital. We've been en route. We're still en route. As we continue en route, I'm going to continue with an ongoing assessment, which would be reassessing my airway, breathing, and circulation. I would reassess my vitals every 5 minutes. I would repeat my detailed if I have time, and reassess any interventions I've done, making sure I still have oxygen, making sure all my bleeds are still controlled, reassessing the pupils because I had one that was unequal, and I'm done with this station.
Consider it done.
I added in some stuff. You don't have to do all. You don't have to add in some stuff. I mean, I did add in like I'm going back.